Hello everyone, myself Srishti Sanap. My coordinators are Nyaneshwari Sarve, Akshata Sangogi. We are from final year B Pharmacy from Shivaji Rao Zondare College of Pharmacy. Today we are here to highlight on topic of cervical cancer and its awareness, guided by Ms. Swati Vaksore ma'am. Here is the content for our topic. Its introduction, its statistics, its types, causes, signs and symptoms, stages of cervical cancer, its diagnosis, how it's treated, its treatment, dietary management, prevention, their screening test, drug treatment, summary, conclusion and reference. Objectives: to access the knowledge regarding symptoms, risk factors, prevention, screening of cervical cancer, and to improve the knowledge and generate public interest in cervical screening and reduction of cervical cancer. Introduction. Cervical cancer is a malignant tumor of the cervix, the lowermost part of the uterus. Human papillomavirus (HPV) is the main cause of the cervical cancer. So, cervical cancer is the most common gynecologic cancer in women worldwide. It is a major public health problem affecting middle-aged women, particularly in less resourced countries. As shown in the image, the normal uterus and the uterus which is affected by the cervical cancer. Statistics: its worldwide cervical cancer is the fourth most common cancer affecting women, and in India it is second most common form of the cancer. So it is estimated that about 160 million people between the ages of 30 to 59 years are at the risk of developing cervical cancer in India. So India accounts for 27% of total cervical cancer deaths. In 2008, 9% of total new cancer cases and 8% of total cancer deaths are of cervical cancer. There are various types of this. That is squamous cell carcinoma. It is common form of cervical cancer, which is 9 to 10 cervical cancer are of this type, and this form in the lining of your cervix. Adenocarcinoma, it is also a form in which the glandular cell that produces mucus. Mixed carcinoma, it is less common. This has features of two other types. So what are the causes for this? Human papillomavirus, smoking, multiple full-term pregnancies, family history, economic status, male behavior and sexual history. Signs and symptoms: bleeding that occurs between regular menstrual periods, bleeding after sexual intercourse, douching or a pelvic exam, menstrual periods that last longer and are heavier than before, bleeding after going through menopause, increased vaginal discharge, pelvic pain. People may also experience nausea, fatigue, weight loss. So there are various stages of cervical cancer, in which the stage 0 is the cancer found on the top layer of the cell of the cervix and have not grown into the deeper tissue. Stage 1, at this stage the cancer cells are found only in the cervix. It hasn't spread to lymph nodes or other organs. At stage 2, cancer at this stage spread outside the cervix and uterus. So it hasn't spread the lower portion of the vagina or to the pelvic wall. Stage 3, at this stage cancer has spread beyond the cervix and uterus up to the lower portion of vagina and the pelvic wall, but it not separate or spread to the nearby lymph nodes. Stage 4, this is the most advanced stage of the cancer. The cancer has spread to other parts of the body like lungs, liver or bones, or it has spread to nearby tissues such as bladder or rectum. Diagnosis: following tests may be used to diagnose the cervical cancer. First is Pap test, HPV test, colopsy, biopsy, pelvic ultrasound test, magnetic resonance imaging scan which is MRI scan, computerized tomography scan which is CT scan. These are all done to diagnose this cervical cancer.
Treatment of cervical cancer basically includes surgery, radiotherapy, chemotherapy, targeted therapy and immunotherapy. Surgery is the main treatment of cervical cancers. Sometimes chemotherapy or radiation are also used to shrink the tumor before surgery or to kill cancer cells that remain afterwards. Types of surgery are conization, total hysterectomy, trachelectomy, pelvic exenteration, laser surgery and cryosurgery. Second is radiotherapy. In radiotherapy, high energy X-rays are used to kill cancer cells and to stop their growth. The radiations are given before or after the surgery. There are two ways to give radiation. First is brachytherapy and second is external beam radiation therapy. In brachytherapy, radiation is given through a small device which is placed inside the body near cervix. This is done for early stage cervical cancer. It can be given in the hospital or even at home. External beam radiation therapy. This therapy is used combined with the brachytherapy to keep the advanced cervical cancer from coming back. The radiation is given with the help of machine outside the body in short bursts once a day, 5 days a week for 5 to 6 weeks. Third, chemotherapy. In chemotherapy, drugs like doxorubicin, cisplatin, bleomycin, etc. are used to kill or slow the growth of cervical cancer cells. These are usually given by IV route. For cervical cancer, chemotherapy is concurrently administered with radiotherapy called as chemoradiation to work better. The side effects from chemotherapy will depend on which drugs you have taken, which include changes in periods, loss of appetite and fatigue, hair loss, mouth sores, nausea and vomiting. Fourth, targeted therapy. In targeted therapy, drugs are used to identify and attack specific types of cancerous cells but spare healthy cells. For example, bevacizumab Avastin is a drug which stops new blood vessels from forming. Due to this, the tumor growth will slow down in advanced cervical cancer because tumors need new blood cells for nourishment and growth. Targeted therapy is often used with chemotherapy. Fifth, immunotherapy. Immunotherapy is the use of medicines to stimulate a person's own immune system to help the body fight cancer infection and other diseases and recognize and destroy cancer cells more effectively. Immunotherapy is used to treat cervical cancer that has spread or come back, reoccurred. Now let's see what is the dietary management of cervical cancer. Flavonoids are chemical compounds in fruits and vegetables that are thought to be a leading source of protection against cancer. The flavonoid-rich foods are apple, black beans, broccoli, Brussels sprouts, cabbage, garlic, onions, soy and spinach. Folate, which is a water-soluble B vitamin, reduces the risk of cervical cancer in people with HPV. Foods rich in folate include avocados, breads, lentils, orange and strawberries. Carotenoids, a source of vitamin A, are also helpful in preventing cervical cancer risk. Foods such as carrots, sweet potatoes and pumpkin are rich in vitamin A. Prevention. First method to prevent cervical cancer is human papillomavirus vaccination. There are many kinds of HPV present, but two of them, type 16 and 18, cause more than half of all cervical cancers. The HPV vaccine thus targets them. The ideal time to get the HPV vaccine is before you become sexually active. Routine vaccination is recommended for girls and boys at the age of 9 to 12, but it can be given as early as possible. For women of age 30 years, screening options are available and according to that, treatment is given. There are 3 different vaccines which vary in the number of HPV types they contain and target. First is Quadrivalent Hpv Vaccine, second is 9-valent vaccine and third is bivalent vaccine. Second, Pap smear test. It tests for the presence of precancerous or cancerous cells in the cervical area. During this procedure, cells from cervix are gently scraped away to look for ones that could become cancerous by examination for abnormal growth. The procedure is done at doctor's office. The US Preventative Services Task Force USPSTF recommends that screening starting at age 21, women should get a Pap test every 3 years until age 65. Third is HPV test. The HPV test is used in combination with the Pap test to detect cervical cancer. The USPTF recommends screening using the HPV test alone or combination of the Pap and HPV test every 5 years for women over the age of 30. Let's see what are the ways to prevent cervical cancer. First, avoid exposure or avoid exposure to HPV, which is the most common cause of human cervical cancer, by limiting the number of people you have sex with. Second, avoiding sex partners who engage in high risk activities. Third, delaying sex until you are older and using condoms to help prevent the spread of HPV and other sexually transmitted diseases. Fourth, avoid smoking, which increases the risk of cervical cancer in women infected with HPV.
Screening test conventional exfoliative cervicovaginal cytology, that is pap smear, fluid sampling techniques with automated thin layer preparations, liquid based cytology, automated cervical screening techniques, neuromedical system, HPV testing, polar probe, laser induced fluorescence, visual inspection of cervix after applying Lujol's iodine or acetic acid test, speculoscopy, cervicography. Drug treatment. Drug approved to treat cervical cancer: Avastin, bevacizumab, bleomycin sulfate, hycametine, Keytruda, Mivasi, pembrolizumab, tistotumab, Tivdak, toptotican, and Zirabev. Drugs combination used in the cervical cancer: carboplatin, Taxol, gemcitabine, cisplatin. Summary: HPV is the major cause of cervical cancer, which is established in the presence of other favorable factors. Pap smear tests, among the other tests, are used for its early detection. Symptoms may be asymptomatic in the early stages. Treatment depends on the stage of the disease. Cervical can be very high when treated early. Conclusion: available evidences have shown that HPV plays the important role in the cause of cancer of the cervix, and recent researches have continued to make its management possible. Therefore, personal lifestyle modification, effective screening facilities coupled with prompt and appropriate management will help to curb the menace of the disease and thereby reduce its morbidity and mortality. Here is the references, then acknowledgement. We are thankful to our Honorable President, Dr. Shivaji Rao S. Chondre Sir, Secretary, Dr. Geeta Mohire Ma'am, Principal, Dr. Nitin Mohire Sir, and for the encouragement and guideline for our efficient use of the social media to spread the knowledge by making such informative videos.